स्टार्ट हो गया.
Our today's topic of the discussion or learning, it is the regulation of blood sugar. We have already studied the chemistry of the carbohydrates and metabolism of carbohydrates, etc. All these things we have already studied. Now the applied part of the carbohydrate metabolism, it is to learn or to have an idea to discuss about the regulation of the blood sugar. When we talk about the regulation of a blood sugar, naturally all of us, we are knowing that the blood sugar level, it is mainly regulated or mainly decreased by the hormone insulin. So before going to start with the regulation of a blood sugar, we will have some idea about the hormones of the pancreas, because insulin and glucagon, these are the main two hormones which are important in regulation of the blood sugar. They are secreted by the pancreas. Okay, so naturally we will have some idea about the hormones of the pancreas first, and then we will have few aspects of what the regulation of the blood sugar. Now, all of us, we know the endocrine function of the pancreas. It is present in the islets of Langerhans. Now, there are three types of cells of islets of Langerhans. The alpha cells, they secrete glucagon. Beta cells, they secrete insulin. And delta cells, they secrete somatostatin. So, coming to the insulin, it is a protein hormone, and it consists of 51 amino acids. So it is a protein hormone, consists of 51 amino acids, and this insulin, it is an anabolic hormone. That is one of the most important aspects of insulin, that it is an anabolic hormone, whereas glucagon, it is a catabolic hormone. So insulin, it is an anabolic hormone, and it exhibits its main effect in the muscle, liver, and heart. So its main effects, they will be in the muscle, liver, and heart. This insulin, it is composed of two polypeptide chains, the chain A and the chain B. A chain, it consists of 21 amino acids, and the B chain, it consists of what? 30 amino acids. So it is a 51 amino acid protein compound, or it is a protein consisting of what? 51 amino acids, A chain and the B chain. A chain, 21 amino acids, B chain, it consists of 30 amino acids. Now these polypeptide chains, they are joined together by what? By the disulfide SS bridges, that is the disulfide bridges, and its molecular weight, it is 5,734. Now this insulin, when it is synthesized as a proinsulin, and subsequently it is converted to insulin. Now zinc, it is a constituent of stored insulin, and it is required for its what? Crystallization. Now all of us, we know, if you can say the person, the youngsters, means the juvenile onset diabetes mellitus or the type 1 diabetes mellitus, they need the insulin every day, whereas the type 2, they may need sometimes the insulin. So when they have to take the insulin, they have to take it injectable, by injection. Insulin, it is not taken orally. Why it is not taken orally? Because it is a protein and it will get digested by the proteolytic enzymes. Okay. Now, by the proteolytic enzyme insulin, and hence it will not perform its action. Is it clear? So, coming to the what? So, we have seen what is insulin, how it is secreted, which cells. Now, factors affecting the secretion of insulin. The first factor for the secretion of insulin, and the most important one, it is the stimulation of the right vagus that causes the secretion of insulin. Now, the second is what? The hyperglycemia directly stimulates its secretion and release. So, hyperglycemia, most potent stimulus for the secretion of insulin. So, it will stimulate the secretion of insulin. Then certain amino acids such as leucine, arginine, certain fatty acids, the gastrointestinal hormones such as gastrin, pancreozymin, secretin, they directly stimulate the secretion of insulin. Epinephrine or adrenaline that inhibits the secretion of insulin. Okay, now naturally, as all of us we know, insulin it is a single hormone that decreases the blood sugar. So, what are the actions of insulin or metabolic role of insulin? So, this insulin it has its effect on carbohydrate metabolism. It has its effect on the lipid metabolism. It has its effect on what? On the protein metabolism. Now, the major aspect of the insulin, it increases the glucose uptake by the cells. So naturally, as it is a glucose lowering hormone, it increases the uptake of glucose by the cells. On carbohydrate metabolism, it increases glycolysis, it increases glycogenesis, it increases HMP pathway, it increases TCA cycle. It inhibits gluconeogenesis and glycogenolysis. Okay, so on carbohydrate metabolism, its effects are like this. Now, on the lipid metabolism, it decreases lipolysis and it enhances the fatty acid synthesis. It promotes triglyceride synthesis and it increases the, you can say, triglyceride synthesis in the adipose tissue and it decreases the ketogenesis. So it is anabolic hormone. So it will decrease all the actions that will cause what? The catabolism. So it increases what? Triglyceride synthesis, it enhances fatty acid synthesis, it decreases lipolysis, it decreases ketogenesis. Now, on protein metabolism, it increases the amino acid uptake and protein. It increases amino acid uptake, it increases protein synthesis, and it decreases the catabolism of the protein. Is it clear? So, this insulin, being the anabolic hormone, it has its effect on what? On all the three major metabolic processes of the body. Now, the second hormone that is secreted by the pancreas, it is the glucagon. And this glucagon, it is secreted by which cell? The alpha cells of islets of Langerhans. And this glucagon, it has near about all the actions that are opposite to the actions of insulin. Now, this glucagon, it is a polypeptide produced by the alpha cells of the islets of Langerhans of the pancreas. Now, this glucagon, it consists of how many amino acids? 29 amino acids. Its molecular weight is 3,485. Hypoglycemia increases glucagon secretion. For example, for the insulin, which is the strong stimulus, it is the hyperglycemia. Whereas for the glucagon secretion, the strong stimulus, it is the hypoglycemia, that is decrease in the blood sugar. Now, most amino acids, growth hormone, CCK, that is cholecystokinin, and calcium, they stimulate the secretion of glucagon. Fatty acids and glucose, they inhibit the secretion of glucagon. Stress and emotions, they also stimulate its secretion. We are knowing that the stress-induced diabetes mellitus, or you can say very emotions or emotional disturbances, etc., that will what? They will stimulate the secretion of glucagon. Now, this glucagon, it has near about all of its action that are opposite to what? Opposite to actions of insulin. Now, on the carbohydrate metabolism, this glucagon, what it will do? It will stimulate what? It will stimulate the glycogenolysis and gluconeogenesis, and it increases the blood sugar level. So all the actions that will increase the blood glucose or that will cause the output of the glucose, they will be stimulated by the glucagon. So it will stimulate glycogenolysis, it will stimulate gluconeogenesis, it will inhibit glycolysis, TCA cycle or HMP pathway like that. Now, it promotes on the lipid metabolism. What will be its action on lipid metabolism? It promotes the fatty acid oxidation, it promotes the lipolysis, and it promotes the ketogenesis. It decreases the fatty acid synthesis, it decreases the triglyceride synthesis. Now, on protein metabolism, what will be its action? It increases the uptake of amino acid by the liver, which in turn increases the gluconeogenesis, thus it lowers the plasma amino acids. So on protein metabolism, it has the catabolic action, it increases the breakdown of a protein, it increases the uptake of amino acid by the liver, which in turn that will stimulate the gluconeogenesis. We know what do you mean by gluconeogenesis? Gluconeogenesis, well known to us, that is the formation of a glucose from non-carbohydrate sources. So is it clear? So before starting with the regulation of a blood sugar, as the blood sugar, it is mainly regulated by the hormones. There is a role of kidney, there is a role of skeletal muscle, but the major role, it is the role of hormones. So we have first seen what are the hormones of the pancreas. Now coming to the what? Regulation of the blood sugar, which is one of the most important function or vital function of the body. Now, the concentration of a glucose in the blood, it is the net resultant of the following two processes. When we say that the concentration of sugar in the blood, it is so and so, so it is the resultant of what? Of the following two processes. First, rate of glucose entry into the bloodstream, that is rate of input of glucose into the bloodstream, and second, rate of glucose removal from the bloodstream, means input and output. These are the two main processes for what? That will be the result, it will be the concentration of sugar. Now, means by which glucose is added to the blood, means there will be increase in the blood sugar level. First, by the absorption from the intestine. Second, by glycogenolysis. And third, by gluconeogenesis. So these are the three major ways by which there will be input of a glucose into the bloodstream. Now, means by which glucose it is removed from the blood. First, glycogenesis. Second, by the synthesis of a fat, by the synthesis of a glycoprotein, synthesis of a nucleic acid, synthesis of a lactose, that is during lactation period, and loss in urine. These are the few means by which glucose it will be removed from the blood. Now, a balance of about these two processes, input and output, two processes that will keep the blood glucose within normal limits. So if these two processes, input and output, the input of a glucose and utilization of a glucose, in the, you can say, they will be equal, the resultant, the blood sugar, it will be within the normal limits. So balance of about these two processes that will keep the blood glucose within normal range. These two processes, they are influenced by what? By a number of factors. Under physiological condition, the blood glucose level, it is most efficiently regulated by a mechanism in which liver, extrahepatic tissue, and a battery of hormones, they play the most important role. So blood sugar, it is regulated by which? By what? There is a role of skeletal muscle, there is a role of kidney, there is a, you can say, it will be influenced by what? By a mechanism in which there will be a what? Liver, extrahepatic tissue, and a battery of hormones that will play the most important role. So most important role, it is played by what? It is played by the hormones. Okay. Now coming to the what? The normal levels of blood sugar. When we talk about the normal levels of blood sugar, the fasting blood sugar, the normal range of the fasting blood sugar, it is what? It is the 70 to 110 milligram per se. That is the fasting blood sugar. What is the post-meal blood sugar level or postprandial blood sugar level? That is the blood sugar it will be taken after 2 hours after taking the meal. Okay, that is the postprandial blood sugar or post-meal blood sugar. And what is the normal range of this? It is the blood sugar, it should be less than 140 milligram per cell or 140 milligram per deciliter. Okay. Now, as already I have told you, when we talk about the blood sugar regulation, there is a role of liver, there is a role of, you can say, kidney, role of skeletal muscle, and most important, it is the role of hormones. Okay. Now, coming to the what, the role of liver. Now, all of us, we know carbohydrates, they are mainly digested to glucose, and also glucose, it is formed from which processes? By the glycogenolysis and by the gluconeogenesis. So when blood sugar level, it is increased, what will happen? The uptake of glucose by the liver and tissue, it will be increased. Whenever the blood glucose level, it will be high, uptake of glucose by the liver, it will, and the tissue, it will be increased. Glucokinase, it is important in this regulation. As glucose level, it is increased, the output of what? Of the glucose, it will be ceased. Output of glucose means the processes that will cause the increase in the level of glucose. For example, the gluconeogenesis or glycolysis, they will be decreased, and in a reverse state, or you can say peripheral utilization of glucose, hepatic glycogenesis and lipogenesis, they are enhanced. Glycogenolysis and gluconeogenesis, they are decreased. And in a reverse state, by falling blood sugar level, opposite that will happen. Okay, so it was the role of liver. Now there is a role of kidney. Now all of us, we know when there will be appearance of glucose in the urine, when it will cross the value of what? Renal threshold for glucose. Means beyond this value, the kidney tubules, they will not be able to reabsorb the glucose totally, and there will be excretion of the glucose in the urine. So when blood sugar level, it will exceeds the renal threshold value, the value is 180 milligram per deciliter. Renal tubules, they cannot reabsorb the glucose, and when the blood glucose level, it will cross its level, that is 180 milligram per cent or 180 milligram per deciliter, what will happen? There will be kidney tubules, they cannot reabsorb the glucose, and it will be excreted in the urine, and there is a decrease in the blood sugar level. Now, high concentration of sugar in the blood, that increases the viscosity, osmolarity, and it is dangerous. Is it clear? So that is the role of kidney. Now, the most important, it is the role of the hormones. Already I have told it to you that the single hormone, that is insulin, it is responsible for what? It is responsible for the decrease in the blood sugar level. Whereas other hormones such as glucagon or the thyroid hormone, growth hormone, anterior pituitary hormones, or you can say the other hormones, they have a tendency, or they increases the blood sugar level. They will not decrease the blood sugar level, whereas they increases the blood sugar level. So coming before that, we will have some idea about the role of kidney. When the blood sugar level, it will exceeds the renal threshold value of 180 milligram per cent, renal tubules, they cannot reabsorb the glucose properly, and what will happen? It will cause the excretion of urine, and there is a excretion of a glucose in the urine, and there is a decrease in the blood sugar level. Now, when there is a high concentration of sugar it is there in the blood. It increases the viscosity of the blood, increases the osmolarity, which is dangerous. Okay, so you can say, so there is a what when we say about the role of kidney. So there will be a what high concentration of the sugar in the urine that will increases the viscosity of blood, that will increases the osmolality, and which is quite dangerous. Now coming to the what, the most important aspect, it is the role of the hormones. Now, as already I have told it to you, the most important hormone that decreases the blood sugar level, it is what? It is the insulin. We have seen the details of insulin, its action. So, when we talk about you can say the role of hormones, when blood sugar it will exceed the renal threshold value, that is 180 milligram per deciliter, the kidney tubules they cannot reabsorb the glucose, and glucose it is secreted into the urine or excreted in the urine, and thereby there is a decrease in the blood sugar level. High concentration of sugar in the blood, it increases the viscosity of the blood, it increases osmolality of the blood. Now, the role of other hormones, that is the growth hormone, its secretion, it will get stimulated by the decrease in the blood sugar. So whenever there is a decrease in the blood sugar, that will become a stimulus for the secretion of what? Secretion of the growth hormone. So this growth hormone, it decreases the blood glucose uptake, it mobilizes the free fatty acid from the adipose tissue, and it inhibits the glucose utilization, and thereby it decreases the blood sugar level. Now the third hormone that is important, it is the glucagon. Now what will be the stimulus for the secretion of a glucagon? For the secretion of the glucagon, the most important stimulus, it is the hyperglycemia. Okay, so that is one of the most important aspects. Now stimulated by hypoglycemia, this hormone, it causes glycogenolysis, and it will stimulate the gluconeogenesis from the amino acids that are present in the blood. Now, the third hormone that is important for the regulation, it is the epinephrine. Now, this epinephrine, it is stimulated by what? By the adrenal medulla, and hypoglycemia, it is the one of the important, you can say, process, and it will increases the protein catabolism and uptake of amino acid by the liver. It inhibits what? The utilization of glucose in the tissues. So that was about what? The other hormone, that is, you can say, about the epinephrine and norepinephrine. Now the other hormones, for example, epinephrine, it is secreted by the adrenal medulla by hypoglycemia. It increases what? The glycogenolysis, and it will in liver and muscle by activating the phosphorylase. Now, the epinephrine, already I have told you, it is secreted by the adrenal medulla, and whenever there is a hypoglycemia, this adrenaline or the epinephrine, it will be secreted. Now, one more hormone it is there, and it is the glucocorticoid. Now, you understand the glucocorticoid means the hormones that are carbohydrate in nature. Now, this glucocorticoid, what will happen to the glucocorticoid? That will be, you can say, the glucocorticoid, it will cause the increase in the blood sugar level. How? Epinephrine, it is secreted by adrenal medulla by hypoglycemia, and it increases what? The glycogenolysis in the liver and muscle. Now, these glucocorticoids, they're secreted by what? Adrenal cortex. It increases the gluconeogenesis, it increases the protein catabolism, it increases the uptake of amino acids, and so naturally it will increases the activity of what? Of the intestine. Now the other hormones, they are what? the thyroxine, then the insulin, and there is a role of skeletal muscle. Now, the skeletal muscles, they are what? They are secreted by what? Insulin is secreted by the beta cells of islets of Langerhans. It is a polypeptide. Okay. Now, what is the most important stimulus for the regulation of a sugar? Most important, or for the, you can say, hormone, the most important, it is the secreted by what? By the beta cells of the pancreas, and it is a polypeptide, and it is not given orally. So that part already we have explained. Now, naturally, so what we have to remember, what are the hormones of the pancreas, what is the stimulus for their secretion. Then we have seen the two processes of the input and output of the glucose. And so naturally, we have seen that how this blood sugar level, it is regulated. There is a role of liver, there is a role of kidney, and there is a role of, you can say, the muscles, etc. So coming to the what, when we talk about the regulation of a blood sugar, we know if blood sugar level, it will not be kept within the normal limit, what will happen? It will, there will be a what? Some disorder, it will come or it will rise, and that disorder, all of you know, it is the diabetes mellitus. Okay. So if we have understood about the regulation of a blood sugar, we have to start with the second part of it. Okay. So the second part of it, it is what we have to decide, or that is the, you can say, the role of the other hormones. So insulin, it is secreted by what? Beta cells of the pancreas. It is a polypeptide. It is not given orally, and it increases the uptake of glucose in liver, muscle, and adipose tissue. Now, there is a role of skeletal muscle. Severe exercise, it causes hypoglycemia. And the severe exercise cause the what? It will cause the drainage of what? Of the muscle glycogen, and thus reduces the body glucose. The, you can say, lost muscle glycogen, it is replenished by what? From the blood glucose. Is it clear? So there is a role of skeletal muscle, there is a role of kidney, and there is a role of the hormones. Now, when there is a derangement in the regulation of a blood sugar, naturally what will happen? It will come, it will get manifested in the form of a disease, which is one of the most important common endocrine function, or it is one of the most important aspects that they should understand about the diabetes mellitus. So what is this diabetes mellitus? This, it is a metabolic disease. The diabetes mellitus, it is a metabolic disease, and it is most common, ends with what? With the family function. This family, you can say, with the family. Now, this diabetes mellitus, it is a what? It is regulated by the insulin. It is a metabolic disease, and most commonly it will end into what? This is the most common endocrine disorder, hyperglycemia, which is mainly due to the loss of, you can say, lack of insulin. There will be a what? That the regulation of a blood sugar, it has to be understood. Now, coming to the what? The most important aspect of the carbohydrate metabolism, and which is clinically most important, it is what? It is the diabetes mellitus. So we have seen in the regulation of a blood sugar, what are the processes for the input and output of a blood sugar. At the same time, we have seen what is the role of liver, what is the role of kidney, what is the role of skeletal muscle, what is the role of different hormones. Okay. Now coming to the what, the applied part of this topic, it is the diabetes mellitus. Now, for your knowledge, you are knowing that every fourth person in the India, if he or she will be tested for the glucose, we will find that they are diabetic. So diabetes mellitus, coming to the what? The continuation with the diabetes mellitus. Now, what do you mean by diabetes mellitus? It is a metabolic disease of what? Which is most important. So diabetes mellitus, it is a metabolic disease and most common endocrine disorder, hyperglycemia due to lack of insulin that enhances what? The polyuria and urine, it is sweet in taste. Now, when there will be a presence of sugar in the urine, when it will cross the barrier value of what? Of the, you can say, the 70 rupees or whenever. So there is a role of, you can say, so that will play the important role, that is sweet in taste, the that solution, and thus the growth hormone, ACTH, TSH, adrenal, and thyroid. They what? They increases the, you can say, the interdepartmental seminar or the, you can say, case type, and that will what? That will cause the, you can say, it will help. Now, what are the common symptoms of this diabetes mellitus? The common symptoms of the diabetes mellitus, they are polyuria, polydipsia, nocturia, tiredness, loss of, you can say, visual activity, loss of activity, etc. So there are many ketoacidosis with diabetes mellitus in acute infectious conditions. Is it okay? So common symptoms, they are what? Polyuria, polydipsia, polyphagia, nocturia, etc. These are the common symptoms of this diabetes mellitus. Now coming to the what? The details of what? Of the diabetes mellitus. So this diabetes mellitus, it is what? It is a commonest endocrine disorder throughout the world. This diabetes mellitus, it is a heterogeneous metabolic disorder and it is characterized by what? By the common uptake of what? The chronic hyperglycemia with disturbance of the carbohydrate, fat and protein metabolism. Now coming to the what? The classification, very first, the, you can say, the diabetes mellitus, it is divided into what? Classified into two types, and it, you can say the second part, it is what? It is previously called as insulin dependent and the juvenile onset, etc. This should not be there. Now what are the types? So whenever there are the disturbances of the carbohydrate, protein and the fat metabolism, it will be there. Naturally, it will turn into what? There will be a, you can say, some sort of. Now, this diabetes mellitus, mainly for the children, we are knowing there are two major types of diabetes mellitus, type 1 diabetes mellitus and type 2 diabetes mellitus. Now, the basic common phenomenon, as already I have told, it is by the destructions of alpha cells. Okay. Now, there is a, you can say, there is a deficiency. Now, genetic susceptibility for the function of a hormone, or it is what? The genetic susceptibility. There is a identical twins that are increased. Then if one twin, it has type 1 diabetes mellitus, then it also has what? That insulin deficiency. Now, the presence of islets of Langerhans, or islet cells and antibodies against insulin, there is a selective, you can say, destruction of a cell, it is there. Now, it has what? Cell-mediated autoimmunity, it is also there. Okay. Now, there are certain, you can say, factors. So, what are the other factors where the, you can say, it will be implemented? That the, so that is the, you can say, the emotional quotient, it is most important. Now, what are the autoimmune factors? Presence of islet cells, antibodies against insulin, selective destruction of a cell should be there, cell-mediated auto, you can say, that is there, and autoimmune diseases like Graves' disease, Addison's disease, that promotes the thyroiditis. Okay. Now coming to the what? So what we have seen that the diabetes mellitus, it is of mainly which type? The two types. And these two types now, the term for diabetes mellitus as insulin dependent and the non-insulin dependent, they have become absolute. So the labs they can have their own, you can say, values also, but ours, it is the central lab, and we have seen that when we talk about the, you can say, regulation of a glucose, there are so many things to be, you can say, to be remembered and to be done. And most important thing is that we should know which is the stimulus for the blood glucose secretion, and at the same time we have to see that for this half an hour whether we are able to explain about what about the X. Okay, so that was about the diabetes mellitus. Now, what are the major types of diabetes mellitus? The major types when we see it is the type 1 diabetes mellitus and type 2 diabetes mellitus. Now, type 1 diabetes mellitus, it is previously called as what? Insulin dependent or juvenile onset diabetes mellitus. Now, type 2 diabetes mellitus, it is also called as what? Non-insulin dependent diabetes mellitus, and there may be a, you can say, so type 1 diabetes mellitus, the basic phenomenon, it is the destruction of a cell mass, usually leading to absolute insulin deficiency. Now, genetic susceptibility, identical twins, if one twin, it has a what? It has a, you can say, the type 1 diabetes mellitus, when there is about 50% chances of a second twin to develop the diabetes mellitus. Now, autoimmune factors, presence of islets of cells, antibodies against insulin, selective destruction of the cell that are important, cell-mediated immunity is important. Autoimmune diseases like Graves' disease, Halsey's disease, there are what? These are the certain factors or the, you can say, symptoms. There is one request, it is there, and that is for what? The environmental factor. Certain lipids, okay, they like the infections, they like the mumps, they like the measles, etc. So they eat that sort of a food very interestingly. And the second, the maize hall, there is a what? Missiles of the geographic and the, you can say, some other aspects of, you can say, the small utensils or that are taken from the diabetes mellitus that can be assessed. Now, when we talk about the, so that was about what? The diabetes mellitus. Now, when we talk about the diabetes mellitus, naturally, the most important aspect, it is the, you can say, type 2 and the type 1 diabetes mellitus. Now, the type 2 diabetes mellitus, genetic factors, identical twins, 80% chances of developing diabetes, or one twin, it will have the diabetes mellitus. In both the parents are diabetic, the risk of offspring to be diabetic, it is near about 50%. Now, what are the other constitutional factors for the diabetes mellitus? One is obesity, second is hypertension, third is low physical activity or sedentary lifestyle, then insulin resistance, then impaired glucose utilization, impaired insulin secretion, and increase in the hepatic glucose synthesis. These are the some constitutional factors or which are that can cause the, you can say, diabetes mellitus. Okay. Now, clinical features of diabetes mellitus, type 1 diabetes mellitus, it occurs at early age, generally below the age of 35. The onset of symptoms, it is often abrupt. The patient, it has the symptoms of what? polyuria, polydipsia, and polyphagia. The patients, they are not obese and they have generally progressive loss of weight. Metabolic complications, they are such as ketoacidosis, it is there. Now, type 2 diabetes mellitus, it occurs in the middle age or beyond the age of 30 or usually above the age of 40. Its onset of symptoms, it is low. The patients, they are asymptomatic. The patients, they are obese and unexplained weakness, it is there. Metabolic complications such as hyperglycemic, hyperosmolar state that are there. Now, what are the complications of diabetes mellitus? Mainly both type 1 and type 2. They develop the complication and they are divided into two major groups: acute metabolic complication, late systemic complication, acute metabolic complications. One is metabolic ketoacidosis, and second, it is what? It is the hyperglycemic hyperosmolar state. Now, what are the other complications of diabetes mellitus? The systemic complications, they are what? Atherosclerosis, diabetic microangiopathy, diabetic nephropathy, diabetic neuropathy, then the periodontitis, etc. The most acute complication which will cause the emergency, medical emergency, will be diabetic ketoacidosis and hyperglycemic hyperosmolar state. These are the complications of diabetes mellitus. Now, how we will diagnose the diabetes mellitus? First, the estimation of a fasting blood sugar level, estimation of the post-meal blood sugar level, glycated hemoglobin, urine analysis, etc. And for the treatment part, most important treatment part, for type 1, the insulin, it is must. For the type 2, the hypoglycemic drugs, diet and exercise. These are the major measures for the treatment of diabetes mellitus. So today we have seen the regulation of a blood sugar. For that we have seen the hormones of the pancreas, then regulation of a blood sugar, and most commonest endocrine disorder, that is the diabetes mellitus. Thank you.